can I come in? Hello, my name is Radley. I'm going to be your nurse today. Can you verify your name, date of birth for me? As I'm introducing my patient, I am washing my hands for 20 seconds. Billy Joel, 12/12/2000. Alright, let me see your wristband. Yep, you are indeed the right patient. Alright, Mr. Joel, I'm just going to ask you a couple questions. First off, are you in any pain right now? No pain? Okay. And then, do you have any allergies? No allergies? Okay, good. And then lastly, have you done a Cvad dressing change before? No? Alright, so I'm happy to explain. So Cvad is a central venous access device, and it's the central IV line that goes through the left side of your chest. And basically what I'm going to do today is I'm going to take off the dressing that's on top of it, and then clean around the site, and then I'll also clean the central line as well. And then once that's done, then I'll replace it with a new dressing. Now, do you have any questions for me? Okay, so how often it's done? So this is usually done every 7 days. Is there any pain? Well, usually patients who've experienced this procedure have never really felt any pain, or it may be a little pain, but usually there's no pain. Okay, so now let's get started. All right, so first off, I'm gonna wash my hands for 20 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. All right, I could put on some clean gloves and then grab my sandy wipe. And with my sandy wipe, I'm going to wipe the table for 30 seconds, starting now. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Alright, 30 seconds is up. Throw that in the trash and I'll let it dry for 2 minutes. Alright, 2 minutes is up, so now I could take off my clean gloves, throw it in the trash, and then wash my hands for 20 seconds. And then now I can put my supplies on the table. I got my bio patch, and then I got my dressing tray. And then now I'm going to open the dressing tray. And then I'm going to take out my sterile gloves. And then I'm going to take out my mask and throw it in the trash because I don't need it. And then I'm going to drop in the bio patch. Make sure it's not too high or too low. Okay, and then I'll throw this in the trash. And then now I'm going to wash my hands for 20 seconds. And then put on some clean gloves. Alright, Mr. Joel, I'm just going to have you turn to your right side. We want to prevent any contamination on the site, okay? And then also, I'm going to be taking off your dressing, so just let me know if you're experiencing any pain or discomfort, okay? Alright, let's get started. How's your day been going so far, Mr. Joel? Good? Good. Has anyone come to visit you? Oh, family? Nice. Who came to visit? Oh, your parents. Nice. That's good that you have a good support system. Alright, Mr. Joel, are you doing okay? That's good. time, I'm holding onto the central line to make sure it's stabilized as I take out the tegaderm. Alright, we're almost done here, Mr. Joel, okay? You doing okay so far? Good. Alright, now that I got the tegaderm off, I can take off the bio patch. Okay, place that down. Then I'll throw these in the trash. And then now I'm going to do my site assessment. I see that there is no redness, no swelling or infiltration or drainage around the site, and no cracks or leaks. And then I also see from the site of insertion to the top of the central line that the length is around 15 centimeters, just as it was previously documented. Okay, so now I've done my site assessment, and I'll take off my clean gloves, throw in the trash, and then wash my hands for 20 seconds. Okay, and then afterwards, now I'll be putting on my sterile gloves. Okay, making sure I only touch the cuff. Okay, now grab this part right here. Then I'm just gonna fix my cuff down here. Okay, now I got my sterile gloves on. I could throw this in the trash. And then now I can pick up the supplies that I don't need. Okay. And then I'm also going to take off the tape because I'm going to be using this later. And then I'm going to grab my tegaderm. And I'm just going to put a little fold on it to make it easier for me to open later on. Okay, I'll put it down. Now I'm going to clean the site. Crack it open. Yep. Alright, Mr. Joel, I'm just going to be cleaning your site now, okay? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Okay, 30 seconds are up. So now I'm going to throw this in the trash. And then I'm going to let it dry for 30 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Alright, 30 seconds are up, so now I could put on the bio patch. Okay. There we go. And then Tegaderm. And then I'm just gonna peel this off with my non-sterile hand. And I'm gonna throw that in the trash. And then I'm gonna make sure I make a stress loop. And then I'm gonna make sure that the Tegaderm is centered. Okay, it's centered, so now I could put it on. And then we're just gonna do one motion like that. And gently tap on it. Make sure it's closed. Okay. Once it's closed, then I could now use both hands. This is now a non-sterile procedure. So I'm gonna make sure that there are no air bubbles as I press on the dressing. Okay, I see that there's no more air bubbles, so now I can take off the border that's around the dressing. Okay. And then now I'm going to label my initials, date and time, showing that I changed the dressing and when the dressing was changed. Okay, so RT, today is March 2, 2023, and it's currently 9:30. Okay, got my label, so now I'm gonna put it on the dressing. There we go. Perfect. And then alright, Mr. Joel, how are we feeling right now? Are you feeling okay? Good, good. Alright, so now I'm just going to be putting this tape on you. That way the central line is secure. There we go. Perfect. And all right, Mr. Joel, do you have any questions for me or concerns before you go? Before I go? No? Okay. And are you in any pain right now? No? Okay, good. All right. So since my patient had a good tolerance, I'll document that. I also document the date and time that the dressing was changed. I also document my site assessment, and I also document that the length of the central line remained the same as it was measured before the procedure. Okay. And so now I'm going to clean my supplies, dump it in the trash, and then after that I'm going to take off my sterile gloves, dump this in the trash as well, and then wash my hands for 20 seconds.